So when women are pregnant, your body's trying to like readjust, rearrange itself for the goal that actually lies ahead. That's the goal of having another human being in you. Do you understand? So because the body is actually preparing to actually have this, human being in you, you have a whole lot of changes in your system. Do you understand? So some of these system changes, we are going to follow it system by system. That's based on body systems by system. All right, so let's look at the systemic changes. So we'll be moving respiratory system, digestive system, genitourinary system. We'll be moving neurological system. There's a cardiovascular system. We're moving system by system just to try to pick up, how every system is kind of like adjusting in pregnancy. So this is like a summary. If you want a summary, you can pause and observe the screen. All right. So first of all, you should know that pregnancy triggers a whole lot of what changes across different systems in the body, different organs in the body, and that changes is not for a bad reason. It's just to support the new baby, because a human being is just working only them. When you have another human being in you, your body has to it's kind of like cleaning up, to welcome the visitor. Do you understand? So in the cardiovascular system, the blood volume increases by 50%, so that there's more oxygen, there's more nutrient rich in tissues, there's also more oxygen, more nutrient rich in the baby. Cardiac output rises due to increased stroke volume and heart rate. Peripheral vascular resistance drops, often leading to lower blood pressure in early pregnancy. A systolic murmur or S3 gallop may be heard in most pregnant individuals. Then for the respiratory system, tidal volume and respiratory rate increases, so there's a whole lot of oxygen. Residual lung volume decrease as the uterus presses against the diaphragm. Estrogen causes nasal mucosal swelling, leading to congestion or nosebleeds. The nervous system, there's mood swings, fatigue, pregnancy brain. The woman, you now be thinking, is this the woman that I've been dating all this while? Like, she's not even thinking again. You understand? The sleep disturbances, increased sensitivities in pain. All right. So in your blood system, we've spoken about it. That's why I said that some of these systems are interlinked. What is affecting one system will affect another. In blood system, your blood volume is increasing by 50%. Okay. While red blood cells rise by what? Okay, the plasma volume is 50. Red blood cell is 30. Okay. So, well, you could just say totally the blood volume boosts by 50%. All right. That's just being specific. So endocrine system, human coronary gonadotropin is there now to support pregnancy. Progesterone and estrogen levels will start heating up. Insulin resistance increases, so there's a risk of the woman developing diabetes mellitus in pregnancy. Then the renal system, she's now urinating quicker. Glomerular filtration rate is increasing. Renal plasma flow is increasing. The amount of blood reaching the urine is increasing. Why? Because you have a lot of how will I put it? A lot of increase in plasma, increase in red blood cells. This is fluid. Okay. So gastrointestinal system, there's a risk of the woman developing heartburns and constipation. Then musculoskeletals, the ligaments losing, okay, because there's a hormone coming in that's relaxing. So there's a whole lot of mobility, okay, and all of that. So immune system, there's modulated immune response, all right, because let me tell you something. The baby is a visitor, all right, and the body doesn't actually accept visitors, all that. Do you understand? So there's a tendency of the immune system to want to attack the baby. So there's modulation so that the immune system doesn't attack the baby. Then skin and breast changes. There's a whole lot of color changes on the skin. Then the breast is kind of like enlarging. All right, the breast is preparing for breastfeeding time. So that's it for systemic changes in pregnancy.